Welcome to Troubleshooting QC Errors with Unity Next Peer QC. In this video, we'll cover how Unity Next can help with discovering, investigating, and troubleshooting QC errors. For modern clinical diagnostic labs, it's important to optimize quality control processes without sacrificing reliable patient results. Data management software with instant peer comparison tools can help optimize QC workflows by troubleshooting QC errors more effectively and preventing delays in reporting that can compromise patient results. Troubleshooting errors is easily done with Unity Next Peer QC. Unity Next Peer QC is the latest QC data management software fully integrated with Bio-Rad quality controls. Unity Next Peer QC gives labs the ability to track and manage their QC data and provides access to peer insights to assess laboratory performance. When you have the Unity Next Peer QC software, you also gain access to the Unity Interlaboratory Program, a powerful peer program that helps labs compare their data. In this video, you will learn about the purpose of an interlaboratory peer program, how to troubleshoot QC errors with peer reports, potential causes of QC errors, how to increase chances of passing a proficiency test such as CAP or an alternative PT program, and how the Unity Next Peer QC software can support these efforts. Let's examine the purpose of an interlaboratory peer program. Why would labs participate in an interlaboratory peer program? The simplest answer is that labs do not want to operate as an isolated statistical island. Labs cannot be certain of their QC results if they are unable to compare their performance against other labs using the same QC materials. With peer programs, labs can leverage comprehensive QC data to have higher confidence in their own results. Participation in peer programs is highly recommended by ISO, the International Organization for Standardization, CLSI, the Clinical and Laboratory Standards Institute, and other regulatory and accreditation organizations. Why use peer programs? Peer programs are valuable in helping to address patient safety concerns. Peer programs also provide the context and perspective of a lab's performance compared to their peers, allowing for immediate action when potential problems are spotted. What is the Unity Interlaboratory Peer Program? Labs across the world run QC on their instruments, but how do they know that their QC results are valid? The Unity Interlaboratory Peer Program is a powerful tool to compare QC results with other labs using the same instruments. This program is the world's largest peer program, with QC data generated from over 38,000 labs and 59,000 instruments worldwide. 68 million QC results are processed monthly. Labs can be confident in the results reported to physicians by participating in the interlaboratory program. There are several ways that the Unity Interlaboratory Peer Program can improve lab efficiency and confidence. By using this program, labs can, number one, identify unrecognized shifts and trends. With reports, labs can stay ahead of the curve and identify shifts, trends, and errors early on that could impact patient results. Peer reports with the latest peer data can be used to investigate suspected issues such as instrument errors, reagent changes, and shifts that occur between proficiency tests. Number two, support regulatory requirements. Lab compliance is always a top priority for lab managers and supervisors because the consequences of inspection findings can be severe. Peer reports from the interlaboratory program can contribute to meeting regulatory requirements by tracking and documenting QC performance. Number three, troubleshoot immediately. Labs can receive notification of shifts in results from on-demand peer reports, allowing them to address QC performance issues in real time. This limits retesting, saving labs time and money. Number four, increase confidence in the reliability of QC results. Reliability is the cornerstone of quality. Labs can access data about a wide variety of peer labs, instruments, and reagents. This volume of data points ensures that reporting is statistically more reliable. And number five, increase confidence in proficiency surveys. The peer program helps labs pass proficiency or EQA tests with greater confidence. If a lab's data is within range of a peer group, they can be confident that their data will be within range during a proficiency test. Now that you've learned about the purpose of an interlaboratory peer program, let's review an example of how to troubleshoot a QC error with peer reports. To address an out-of-control event, a lab should take a two-phase approach to the process. In Phase 1, the focus is on troubleshooting, that is, detecting the problem, stopping the testing process, investigating the cause of the problem, and correcting the issue. This phase is critical for addressing any immediate concerns. In Phase 2, the focus is on recovery, evaluating the testing process, mitigating any risks, implementing preventative measures to avoid future out-of-control events, and documenting the process. Let's walk through an example of the two-phase approach. The following example demonstrates how peer reports can be used in Phases 1 and 2. First, we'll look at Phase 1. In this example, a lab runs QC twice daily. During the evening QC run, the lab manager realizes that glucose was flagged as out of control. An error has been detected. The lab manager immediately stops reporting patient results to investigate the problem. Upon investigation, the QC result for Level 2 was below the QC limit and displayed as a 1(3)S rule violation. The lab manager also noticed that all results for Level 2 were consistently below the QC target mean in the last 24 hours. To understand where the issue may have occurred, the lab manager uses Unity Next Peer QC to compare the lab's QC results with peers. The results from peers are also below the Level 2 limit, showing the same shift. Now aware that their QC performance is showing the same shift as peers, the lab manager is confident that glucose is within range for their lab. This means that the issue is not specific to the lab and that the root cause is likely something affecting multiple labs, such as a reagent or calibrator lot change. The manager reviews the QC changes and notices that a reagent lot was changed that caused a shift 24 hours ago. They conclude that the lab shifted away from the target. To troubleshoot, they readjust their new target limit based on their own values. The manager recalculates the new lab mean and compares it to the peer mean to set a new target. In Phase 2, there are multiple post-recovery steps. However, we will jump to the last step to focus primarily on troubleshooting the QC error. As a best practice in the last step of Phase 2, the lab manager digitally documents the response to the QC error, including corrective actions, in case a similar problem should happen again. Digital documentation helps ensure that appropriate compliance is met. QC errors can occur for a variety of reasons. Now that you've learned to troubleshoot a QC error with peer reports, let's explore the potential causes of common QC errors. QC errors can be caused by shifts, trends, and random errors. Shifts can result from changes in reagent formulation, problems with the calibrators, reagent lot changes, and instrument issues. Trends can result from problems with the calibrators as well as from problems with the quality controls. Random errors can be caused by improper handling and use of QC material, power supply fluctuations, and a variety of miscellaneous factors, including inadequate adherence to standard operating procedures. In addition to troubleshooting QC errors, an interlaboratory program and its peer reports can help increase the chances of passing a proficiency test or similar EQA programs. Let's look at how peer reports can better prepare labs for this type of testing. Proficiency programs test QC performance periodically, usually once a quarter or once a month. Think of proficiency tests like a camera, providing a snapshot of performance at a given time. In comparison, an interlaboratory program provided through Bio-Rad's Unity Next Peer QC helps ensure reliability in testing results between proficiency testing windows. Think of an interlaboratory peer program like a live video that continuously monitors the lab's performance. Using peer reports, labs can review QC performance periodically or prior to a proficiency test to verify that QC results are within range. This reduces the risk of a failed proficiency test result, enabling labs to take corrective action before patient test results are impacted. Peer reports can inform if QC results are outside of target parameters, inform if QC results deviate from peer and method groups' SDIs and CVRs, help labs investigate a failed or questionable proficiency testing result, and ensure quality performance and reliable patient test results between proficiency testing windows. For example, in this peer report, all analytes with parameters outside of the set limits will be listed with indications of what is exceeded. The report will show all levels. Here you see a lab with a level 2 SDI of -2.1, which is unacceptably low. In this video, we learned the purpose of interlaboratory peer programs provided through Unity Next Peer QC and how they can help labs optimize their QC practices. Let's review. First, the purpose of peer programs is to increase reliability in patient test results. Unity Next Peer QC provides access to the world's largest peer program with 38,000 peers. This diversity and volume of peers ensures more reliable reporting. With Unity Next Peer QC, labs can start evaluating QC performance across controls, instruments, and peers. Next, Unity Next Peer QC has a number of powerful capabilities to optimize labs' QC practices. Intuitive navigation and troubleshooting tools make it effortless to manage QC information. Labs can identify unrecognized trends or shifts and track, document QC performance, and pass proficiency or EQA tests with confidence. And finally, Unity Next Peer QC gives labs instant access to peer reports to compare QC results at any time. This way, they can troubleshoot QC errors in real time before they impact patient test results. With no QC data submission deadlines, peer data is updated daily for real-time analysis. All laboratories run QC and want to be confident about their results. With Unity Next Peer QC and its comprehensive data, labs can compare their performance against other labs using the same QC materials to validate their performance. As the latest addition to the Unity family of products, Unity Next Peer QC helps optimize quality control processes and empowers labs to make impactful decisions. To learn more, visit the Unity Next Peer QC site.